So we're Labor Day, 2 weeks away. Where'd summer go, huh? It ended up not being quite the summer we had hoped for, but I think for the most part we're all hanging in there. And the good news is we may be getting up on the halfway mark of this current wave, and that's always good news, because once you're on the back end of it and cases are sliding down rather than sliding up, that's good news. So we'll have to see what the next 2 weeks brings, but I feel it coming up for us. Special guest this morning, Dr. Kacy Ramirez, Pediatric Infectious Diseases at Wake Forest Baptist Health. And then once we get through the business of talking about the news over the last week and what it means and doesn't mean, we'll talk about our kids and going back to school and what COVID means and how to keep them safe. And so we're really, really happy to have her with us this morning. So what's going on in the country? Overall cases are still going up nationwide, but they're sort of shifting a little bit. So if you remember, the Delta variant first surfaced in Missouri, particularly southern Missouri around the Ozarks and northern Arkansas. Those areas have flattened out, and actually Missouri's coming down now, and northern Arkansas is starting to come down too. So that's good news, and that gives us a little bit of an idea of how long the wave lasts, because the wave moves just like it does at the beach. It goes through sandbar number 1, sandbar number 2, and then it hits the beach. So we can kind of get an idea what might happen here. The areas that are really getting pushed right now with cases of COVID are some parts of Texas, particularly the urban areas in Houston, Austin. So if you like a good music venue, you might want to wait a couple days before you go back to Austin. I say that because somebody in the room here is from Texas. So, and then Mississippi and Alabama kind of snuck up. People weren't really watching it, but some of the highest case rates now in our country, and remember, a case rate is number of cases per 100,000 in a population, is actually in Mississippi. And it's about 250 per 100,000. Florida is starting to plateau a little bit, which is good news for them down there. Particularly northern Florida and the Miami-Dade area. And so we can watch what's happening there. Here in North Carolina, for those of you who are daily followers of the North Carolina dashboard, which you can get just by Googling North Carolina COVID dashboard, and it comes right up, you'll maybe see that things might be plateauing a little bit. Before you start throwing the masks away and running out to the clubs, you might want to watch it for a few more days just to make sure that that trend continues. But some of the areas, particularly in North Carolina, that we're seeing the COVID wave with Delta first, the southeast, all those places that you drive through on your way to the beach, are starting to come down some. Here in the Triad, we're still slowly going up, but like most of this wave, we've been going up slower than other areas. And that probably reflects that our vaccination rates here are higher. Not quite so much in Davie and Wilkes and Iredell and Rowan. Their case rates are about twice as that of here in Forsyth County. And their vaccination rates are about a little more than half of what we are here in Forsyth County. So that thing that you hear about under-vaccinated areas being the ones hit the hardest is true here, even here at home. Our hospitals here in the Triad are busy. I guess if you want to pull some good news out of this, we're not as hard up as Alabama, which just stated today that their ICUs are completely 100% full. And we're not as quite as tight and compressed as in northern Florida or some parts of Texas. We'll talk a little bit about pediatrics in our hospital in a little bit, but we are tight here in the Triad. we're having to adjust a little bit how we take care of patients. Nothing major, but if you see a healthcare worker out there, somebody that you know, give them a salute and tell them thanks, because we're working hard right now, and probably will for another week or two, I think. But in general, we're taking care of our patients, and I speak for all of the health systems in the area, and our patients are getting great care. ED waiting times are a little long, so we ask that you not come to the emergency department just to get tested for COVID or for minor illnesses or injuries. You might want to think about an urgent care center or your primary care physician before you come to the ED. Winston-Salem here in Forsyth County put out a local mask mandate this week, and I applaud Mayor Joyner and the Winston-Salem government for that. I think it's a great idea. It helps some businesses a little bit, and I can tell you how, because I get emails saying that my business, won't name any, but thinks that wearing masks would be a good idea, and we've had a lot of our patrons ask for that, and then they get people who push back against that. So if you have a mandate, then it's easier for businesses to do that. What does the mandate say? That indoors you have to wear a mask, unless you're in your own private office or in a situation like that where you're all by yourself indoors. If you're speaking, such as I am here, you should be about 10 feet away from other people, and it says that social distancing is important and essential, and that social distancing might vary a little bit depending where you are and how you are in the situation that it is. Outside remains the place to be in times of COVID waves, so anything outdoors is a place where most of the time you don't have to mask unless you're packed in with a bunch of people waiting in a fast food outdoor line or something when there's people all over the place, or then you can put it on. So last week we talked about a third dose for immunocompromised people, and notice I said third dose for immunocompromised people. I did not use the word booster dose for immunocompromised people, and that's because as time went on and data more and more accumulated, we found that immunocompromised people did not respond as well to the initial 2-dose regimen. And the more, it makes sense, the more immunocompromised you are, the less you responded. So, and then we found out a third dose for those people was safe and effective and boosted them up to get their immunity higher. So those who didn't respond to the first two, about 50 to 60%, depending on the group, would respond to, with the third dose. So I think most of our health systems will, if they haven't started it quite yet, they will be next week. It takes a while to get everything on board. I mean, the state didn't give us the way to even report it for the reporting mechanism until early this week. So that'll be next week. So if you have questions about that and you want to know if your particular health condition is immunocompromising, you can go to the CDC website and they list them all for you. But just a summary, it's mostly people who have cancer, who are on chemotherapy, people who've had bone marrow transplants, people who are on something called TNF-alpha inhibitors. Usually that's for rheumatoid arthritis or inflammatory bowel disease. Most people who are on a TNF-alpha inhibitor know it by that name. People who are on dialysis or have end-stage kidney disease waiting for dialysis, and then solid organ transplant recipients. So those are the people we would like to give a third dose right now. The other thing that was announced this week by the federal government was boosters. I'm not sure the word booster is the right word, but we'll go ahead and use it since that's what the federal government is. And a booster shot is a shot given to somebody who's completed the primary series, who, because of waning immunity, gets a booster. So it's kind of like a tetanus booster, right? We're all used to that. You step on a rusty nail, you get a tetanus booster. So it's kind of like that. You're going to see an interesting discussion between different groups of scientists about booster shots, and it's going to be confusing. I'll go ahead and warn you, because it really gets into the nuances and how we look at vaccines and vaccine effectiveness, and there's a lot of infectious disease science that'll go in behind that. Right now, the data hasn't even been totally looked at and parsed out about the efficacy and safety of booster shots for people who are otherwise healthy. And what does that mean? Well, it could mean that technically we may not need them. I'll explain more of that in a minute. It also might mean that a booster shot may not, probably won't, 100% remove the odds of you getting a, quote, breakthrough infection if you've been vaccinated. It's, although I 100% believe it's going to be safe, I'd like to see the data about safety for booster shots first, just like anyone would. So we have to go through that process. The FDA has to look at it, the CDC has to look at it, that committee at the CDC called the ACIP. So if the alphabet soup's not getting you, these are all the agencies that go through that stuff. Mm-hmm. And once we do that, then those shots will be available. So when that might be, I'd probably mark your calendar for around October 1. And then we have to find people to give them all. That's a lot of shots. And I do not think, for the most part, that we're going to be doing it like we did with the initial vaccination series. I don't think you're going to be seeing large, huge vaccination events that are in other areas. So the Dixie Classic Fair doesn't have anything to worry about, because that's where they'll be, at the fairgrounds, rather than a vaccination site. But we'll find ways to roll it in. And one of the things about giving booster shots starting around October 1, what do we usually do in October? We give flu shots. And that's so we can do the two together. That's probably the way it'll roll out. It's not an emergency to run out and get a booster shot, because the CDC released yesterday on the MMWR, right now, vaccines are still protecting us from hospitalization and serious infections. In fact, here locally, 95% of the people who are in our hospital right now with COVID are unvaccinated. About 96% in the ICU are unvaccinated. And 100% of our patients on ventilators are unvaccinated. So it's the unvaccinated still who are really suffering from severe disease. So the shots, the vaccines are working yet for that, which means it's not an emergency for you. The breakthroughs, quote, are basically COVID colds. Some of them may be bad colds. Most of them are mild colds. But that's what they are. They're annoying. They get in the way. You still have to isolate or quarantine. Hopefully the boosters will help some with that. But I really want to make sure people understand that they may not 100% prevent breakthroughs if you've got a booster. And that's just the way vaccines work. We get colds every year from rhinovirus, even though we're immune. And it's because the infection that you initially get when you get a cold from a virus, even if it's a COVID cold, is up here. It's in the nose, the back of the throat. And then the immune system cuts it off right there. And that's how our immunity works, and infectious diseases for respiratory viruses work. So When will full FDA approval come? Right around Labor Day, I'm thinking. Sometime either a few days before or a few days after. And that will be the Pfizer vaccine first. That's, it's not like the FDA called me and said that's going to be the date, but it's a pretty good estimate. And then what about for our kids? We have been saying that the data should be analyzed and ready to go for EUA sometime between Halloween and Thanksgiving. So those would be the kids under 12. It may not be all the way down in age. We'll have to see where the bottom cutoff is, but I'm pretty sure it'll include all of our elementary school students. So, so that'll be good news. I really would not like to see a bunch of adults running out trying to get their booster shots and have them get in line before our kids. And that's just the way I feel. There may be some adults out there who disagree with me, but we got to get our under 12 kids going. And it's important for school. So with that, the transition, let's talk about school. Let's talk about kids, and let's talk about COVID in kids. I think overall, I'll just ask Kacy Ramirez, our infectious disease expert for children, what is a pediatric infectious disease doctor? We'll start with that.
Well, welcome everybody. I am, I've been at Wake Forest for about 8 years, but I treat children that have infectious diseases. So I'm a pediatrician, and then I did fellowship, and I specialize in treating children with infections and infectious diseases, just like Dr. Ohl, but in pediatric patients. So
that's good, because a lot of people didn't even know there were special pediatricians for infectious diseases.
Correct.
But they are. So what are you seeing right now with kids and COVID?
So as pediatricians, we're a little concerned because the rates in the community of COVID are going up, and so we're seeing more children in the hospital and in the clinics with COVID. And what does that look like? So for us, most children that are healthy might get a cold, and they may not be as sick as your patients. But any children with underlying comorbidities, so that includes asthma, that includes obesity, it includes children that might be African American or Alaskan Native, Hispanic, or children that are immunocompromised, so they're getting treatments for cancer, or they're immunosuppressed. Those are the children, and maybe the very young infants, those are the children that might be a little more susceptible to severe disease and infection. So most kids are healthy, so a lot of them are having colds and not as ill, but those with underlying conditions are getting more sick. And I don't know what the breakdown is in the hospital as far as what percentage, like what are the age groups that are being affected, but in our experience, we're seeing older children, teens in the hospital, and particularly those that have those underlying immunocompromising or comorbid conditions. And the concern right now is that we're just seeing more of it. And as you've heard in the news, we're in places where there's a lot of COVID, there's a lot of hospitalizations, and it's overwhelming our hospitals. Not necessarily here, but in Texas and all these other places, we're hearing about this, and we're concerned about that.
In children's hospitals.
In children's hospitals, yeah. Yes. And what's also interesting is that RSV, which is another common virus that we deal with in the wintertime, is now becoming a problem in the summertime, and that is a very common cause of hospitalization. So we're also being burdened with this other virus, and that's also increasing rates of hospitalizations.
So it's like those other cold viruses
Yes.
that can sometimes be severe.
Yes.
Have kind of rebounded a little bit compared to last year then, huh?
Correct. And obviously we're going back to school, and our children are going to be getting together, and we're dealing with a different virus, which might be more contagious. We don't know if it's more severe in children. but it could be. And we're going to be in closer, tighter spaces, and that can be concerning, especially if we don't have children that are vaccinated, or not as many children over 12 are vaccinated as much as we want them to be. And there's not necessarily a mandate for masking and strict social distancing. And so we're concerned.
Yeah, and it depends where you live a little bit for that
Correct.
last part, yeah.
Yeah.
So let's talk a little bit about it. So, because it sounds like what you're saying is that most kids who get COVID do fine with it. It's a cold.
Correct.
And it's not severe. And so it tends to not be as severe as what we see in adults. But the ones who really should take extra precautions and more likely to be hospitalized if they get COVID are ones who have other illnesses or underlying things, and that includes obesity.
Correct.
Which unfortunately is more common these days
Yes.
than it was a few decades ago.
Mm-hmm.
So, of the people you see in the hospital, then most of them are people with underlying conditions or immunocompromised.
Correct.
So, I think that's kind of a, not to say that that's, good news, because of course for those people it's not. But for people whose children are otherwise healthy or doing well, it's not, they can maybe rest easy a little bit. Not let down a guard, but rest easy. What about long COVID in kids? I get asked that a lot. The percentages that, or what is long COVID in a kid? What is it like?
So COVID is still relatively new, right? So we're still learning things about it every single day. And long COVID is just prolonged symptoms of some of the symptoms of COVID. So mostly we hear about fatigue, exercise, poor exercise tolerance, just lack of energy, to do their sports or to go to school. Their routine tasks are impaired. Sometimes we're hearing about brain fog where they just, feel a little confused. And, that is something that we're hearing, we hear about. I don't know what percentage of children go on to have that, but it's definitely something we're looking at. It also looking at long-term effects of COVID on the lungs and on the heart. But there are a small percentage of children that are going on to have sort of prolonged symptoms for several months, and it's still affecting their life. Yeah.
Yeah, I saw a study out of the UK with Delta just more recently that says it's about 1.5% of kids might go on to have prolonged symptoms. Which is not a high number, and it's not as high as it is in adults. So just another good reason to be a kid, I guess. Yeah. Let's talk a little bit, because we had mentioned about school. And what are some of the things that you would look for a school to do to help protect their kids and their teachers and staff, by the way, from COVID or from having clusters or outbreaks?
So our goal as a community is obviously to gain immunity to COVID. So to create antibodies that will protect us from COVID. So you talk about the easy way and the hard way. The easiest way is to get vaccinated and have a shot generate those antibodies for you. That's the safest and most effective thing to do. And we don't want our children to get COVID, right, to become immune to COVID. So the safest thing...
I would agree with that,
okay.
Yeah.
The safest thing we can do right now is get our child immunized. So if they're 12 and up, we get them immunized. And as soon as we can in the fall, we get our children less than 12 immunized. If we don't have that opportunity yet, I have 3 children, so none of them are yet eligible for their COVID vaccine. What can we do for our children when we send them to school? So, we can choose to send them to a school that we know will do the most to keep them safe. And those things are practicing social distancing and cohorting and masking. So everyone's talking about masking, and right now the safest thing is for children over 2 years of age to put on a mask or in school. And we've been pretty successful with that last year, and even in daycare situations. So right now we're dealing with a new virus that could be more contagious, and we're coming closer together, and our children aren't vaccinated, and enough aren't vaccinated, so we need to really practice the masking and social distancing when we're in school.
Yeah. This is something that I keep bringing up, in that, vaccine is really the best way to get a big slice of Swiss cheese in there, but so the virus coming down will get stuck. But masks are probably number two, and some school jurisdictions, such as Guilford and Forsyth County, I mean, their kids will be masked. I mean, it's the school board's mandated, and in talking with the superintendent, they're going to enforce that. So, but let's say you're in a district that said masks are optional. Would you, as a parent, send your child to school with a mask?
Yes, I would. I think we know as pediatricians there are so many benefits to getting our children back into school. It provides so many resources. It helps them socialize. And there's been enough research out there to say that they really benefit from going to school. So we really want to get back to normal and really get them in the classroom as much as possible. But I think as a parent, if it's not mandated that you wear a mask, the best thing to do is to have a discussion with your child about that and tell them what the importance of doing that is, and encourage them as much as you can to wear it in school. And they might hear things from peers, or be teased about things. I mean, that happens everywhere all the time. So it's just having a discussion with them and your child, and just asking them to do their best to protect themselves and their friends is really what you need to do, and encourage them to do that as much as you can.
Because I mean, one of the reasons we wear a mask is in case we have the virus, is to not give it, but the other big reason is to not get it ourselves. It works both ways, it turns out. We didn't know that early on, but we do now. So I would agree with you totally. My kids are going to school with a mask, whether they have to or not.
Right.
And so let's go ahead and take some questions, because we got quite a few here over the last week. And some of these I could take. Aaliyah asks, should colleges and universities take stricter COVID guidelines than K-12 schools, since there are older students who are likely to socialize more and possibly spread COVID? So I've been working with several local colleges and universities, so I'll go ahead and take that. Yes and no is the answer. So a lot of universities have had vaccine mandates, which I support for a university. In fact, I really think for a university to have any kind of a normal semester or year, their kids, the kids, college students should all be vaccinated. And right now, with heightened transmission in communities, I think that universities and colleges should be masked. And that would include in their classes, obviously, and then also in their social and other activities. We know from some recent studies from the CDC that in vaccinated people, the Delta variant still finds its way to transmit from a vaccinated to a vaccinated person in certain situations, such as dance clubs and crowded bars. And having been a college student once, I know that those are popular places for college students. And if you're not masked in that situation, transmission could occur. So, take it outdoors, be outside. Outside activities are better than inside. If you're going to be inside, then find the coolest mask you got and enjoy a little social activity in a safe way. The one thing about universities that's really different from K through 12 schools are the residence halls, because kids sleep in dorms and socialize in those areas, and those can be areas where transmission can occur. I will say one thing, and I'll say it quite emphatically: the safest place on a college or university campus, as far as COVID goes, is in the classroom, because people are masked and the activities are such that, and so far so good. We really have had. It's very rare to have had a classroom transmission. The same thing in K through 12 schools. Classroom transmission is just not common. It's the pizza party after the club activity or after the football game. So, let's see here. How can schools with children too young to be vaccinated set up the lunch setting to reduce the risk of COVID transmission? That's a great question, because I've yet to figure out a way to eat with the mask on. So how should a school do that?
So if your mask is off, then you have to socially distance, and that's where that becomes important. So it's trying, if you can, maintain as much space. It's maybe doing shifts of people in the cafeteria, like to decrease the total amount of children that might be in one place at one time. It's doing it in a building, in an area that's big and more well ventilated if you can't do it outside, or it's doing it in classrooms and cohorting in classrooms. I don't know what else to say about that. I mean, obviously we wash down and clean and afterwards, and then try to serve meals that are prepackaged. But do you have any other thoughts?
Yeah, well, I know a lot of schools, when they can, they take it outdoors, which I think the students kind of like anyway. Yeah. Except when it's pouring. Yeah. But yeah, that is the one time where you have to kind of be careful. And the other thing is to keep the kids from dawdling, which they tend to do. At least mine do. And get them through the meal quickly. Yeah. In a spaced out way, as you mentioned, but that is the one area where you have to watch out a little bit. The cohorting here is important, because if there's an exposure, technically an exposure in a school now is 15 minutes within the social distance space, which in schools is mostly 3 feet, although I think the state's still saying 6. It says
6.
And then, but if both kids are masked, then the exposed child does not have to quarantine, and that is probably a fantastic reason to keep your child masked.
Right.
So, remind us, please, about mask quality and why to cover the nose and mouth. Boy, that's a good one.
So we can spread COVID through respiratory droplets, and so that would be generated and expelled through the nose or the mouth. So we need to cover those areas so as to not spread it into our environment. It's best to have a mask with 2 layers, with breathable, washable cotton fabric. Covers the mouth and nose. It needs to be snug to the face, and the little pinchy nose bridge ones are a little better than others. I mean, I still struggle to find the best mask to fit my child's face, or the one that my little 3-year-old will keep on, But, it's important to have a washable, breathable material with at least 2 layers, and try to make it as snug as possible. And if we're going to do the neck gaiters, they talk about doing, those need to also have at least 2 layers, or you can kind of flip them and make like double them up in that sense. But
I think the high school kids like those Gaiters.
Yeah.
And that's...
My 11-year-old likes her Gator.
Does
so,
he? Yeah. But yeah, you know, I think it's important that it's comfortable for the child. I mean,
Right.
think about it. Who wants to wear an uncomfortable mask?
Right.
And then, so, does a child need to wear an N95, do you think?
We'll trying to avoid using N95 masks and saving those for our healthcare workers. You have mentioned before in the past, if you have an immunocompromised patient or an adult, you know, sometimes you might be a little more careful. But as a general rule, no, we shouldn't reach for the N95s necessarily.
Yeah, I don't think it's needed in most situations. Our patients who are immunocompromised, though, it really isn't. Maybe a little bit of an extra layer of protection from the mask. But otherwise, yeah, I agree with you. I don't think it's necessary. So there's some good questions in here. Are the under 12 unvaccinated children still faring well overall with the COVID illness? I'm terrified of sending my 9-year-old to school where masks are optional.
Well, we kind of addressed that one.
Yeah, we did.
But, you know, if your child is previously healthy but they're obese, you need to be mindful of that, and then that they could be more severely affected by COVID. They have asthma or any other underlying medical conditions done.
So it
They
sounds
may be
like
more at
that's
risk.
kind of a discussion for the parents and, you know, risk versus benefit.
Correct.
But you need to keep in mind that there's a lot of benefits to being in school.
Correct.
And we really did very well with our masks and school systems that used them last spring. So, yeah, it's a tough decision, but you know, one might feel a little better by looking at the experiences over the summer that we've had, and with camps, you know, particularly day camps. Now, a residential camp or the sleepover camps are a little different, but
Yeah.
but the day camps have done pretty well. Very few outbreaks, very few clusters. The clusters we've seen in kids, I know from the health department side, have been in daycare centers, particularly those that have not been masking. Classroom. So pull out your engineering degree there. Can we talk? Can we do it without windows that open, so on and so forth?
Well, I mean, the easiest thing is if they have windows or doors that open up to the outside, you try to open them. If you have a fan, you would turn it towards the outside and then try to get air to circulate through the room. I mean, I've read that there are things that we can do with the HVAC systems, and you can run them a couple hours before school or in the building and filter the air out that a little bit. I've read about air filtration systems that they could put in there. I don't know if you have any other thoughts or ideas.
Yeah, my idea is
hard one.
ask an expert.
Yeah.
And there actually are experts in this area who in building ventilation. And you know, a school could easily consult with one of these. They can go in and measure it in a room and actually see what it is. In fact, one of the schools that I've worked with, they came through and found out that actually opening the windows made it worse because it interfered with what the normal pressures were in the room for its ventilation. So the other thing I read this morning is that all these plastic barriers that people have been putting up here and there, in many instances don't work and actually interfere with airflow. So it's one of those things that seemed like might be a good idea, may not be. So just a few more here, and then we'll wrap up. So this is a tough one, and so my child is an oncology patient in remission, still getting maintenance therapy. Her doctor here at Brenner, our children's hospital, said he would think going back would be just fine, but she's 3.5 and going just into preschool, and there's no mask rules. I would love to still be able to send her because she has missed out so much with 16 months of active treatment, and she needs the social and emotional relationships, ability to learn and be a normal child. I'm really stuck on what to do. So this is a fantastic question, but not an easy one.
Yeah, this is the hardest of all the questions. So I'm struggling as well with my 3.5-year-old going to pre-K program. But the benefits, what we really do want your child to be in that situation, if she can be socialized and learn. So how can we do it the safest way? Have a conversation with her about the mask, and maybe wear a more protective mask, and have a discussion with the school and the teachers too, maybe about precautions, and just encouraging as many children in the class to wear their masks and socially distance as much as possible.
Yeah,
it's hard.
It is. Hard. I know of a specific instance where the parent with a child such as this went to the school and the teacher, and they talked to all of the other parents, and they all agreed to have their child come to school with the mask on too. And so sometimes if you make it personal, mm-hmm. and people can understand that it gets beyond the sort of weird politics that are going on. So there are some, there are private school options. Most of the private schools that a good many of them have mask mandates right now. And certainly if it's in Winston-Salem, city mandates itself. That includes the schools and the private schools. So you can look around in that situation. But you can talk with your own oncologist and your own infectious disease, pediatric infectious disease doctor too, because there's nuances about the types of therapy and things that not everyone's alike.
Yeah.
So, so we touched on this earlier because Karen asked, can you explain in detail the symptoms and severity that doctors are seeing in pediatric cases, and how does Delta seem different in terms of what we're experiencing? You'd mentioned we don't really know if it's more severe.
We don't know. It could be, but we don't know at this point.
Hospitalizations for adults seem to be a little bit more likely with Delta, but otherwise we're not sure, and even in adults, if it's that much more severe. But you would think we would know by now. If it was really more severe, it would have been surfaced by now. So the fact that we're still debating it mm-hmm. means that if it is more severe, it's not going to be huge. So, see what we got on this side. Ooh, what's the best way to keep our kids safe on the bus ride? The school bus. Some of my worst memories of elementary school. Yep.
So the more children you have in a more crowded space, the more risk of transmission. So to open the windows, crack the windows, try to get as much space as you can between the students, encourage them to wear the mask.
Yeah, in fact, you have to wear the mask by federal law still, but the one school bus outbreak I remember from last spring, actually, the children were unmasked and they were all crammed in the front of the bus. So spread out, open the windows, and I know a lot of the camp buses were doing that. Had a pretty successful summer. So, I have a 6-year-old. My concern is she will soon have to get the vaccine. What are the long-term effects? Do we know? Will it cause a type of cancer, or will it hinder her ability to have children when she's older? Has this type of vaccine been around for 20 to 30 years to study the long-term effects?
Well, vaccine's been studied in a lot of patients, including children, and it's safe. Does not cause any of those side effects that you mentioned, so you can be reassured about that. And it's one of the best vaccines we have.
Yeah.
It's one of the best vaccines we have. And what speaks to that is the only people right now in the hospital have not had a vaccine. Most of them. 95% of them, right? So it's really a good vaccine. And
are you going to vaccinate your kids?
Safe, yes.
You're going to vaccinate your
Absolutely.
N12? Yep.
I'm waiting until her birthday, which is just coming.
Yeah, me too. I wouldn't even think another way about it. The fertility thing comes up a lot, by the way, and that's been completely debunked. I can't even think of a way how this vaccine could do that, actually. And so I'm not concerned about fertility at all. In causing cancer, we've never had a vaccine ever that's been studied that's caused the cancer.
Prevents cancer.
In fact, it prevents cancer, so for
HPV
HPV,
prevents cancer, actually.
So, but yeah, so, and then with anything we do in medicine, it comes down to a risk-benefit, right? And the benefits of the vaccination are much more than risk. So, but I get asked about myocarditis, because with the messenger RNA vaccines, there was a pretty rare event of myocarditis. What do you tell your parents of children about that?
So we've seen of rare cases or instances where children, generally teenage boys, after their second dose of vaccine within the first week, have myocarditis. It's been mild. There's been no deaths, but it's been a rare reported occurrence. The risk of that is so small compared to the benefits of the vaccine, which keeps you from being in the hospital, keeps you from being sick, keeps our children from dying, and then would also prevent the myocarditis, which there's a lot more myocarditis that happens following COVID than there is just from the vaccine. So the risk and benefit is overwhelming.
Yeah. So it turns out that if you're looking at that old scale, that your chances of getting myocarditis are actually much greater from just hanging out unvaccinated and getting COVID.
Correct.
Because the rate in the 18-year-olds to 25-year-olds, somewhere in there, is roughly 55 per 1 million people. So if you like those odds, buy a lottery ticket. But it's really rare. The child's much more likely to get COVID and have myocarditis afterwards. So, but it's a good question to talk to people about. With that, here's a good question. One more I'm going to do before we wrap up. My children ages 8 and 11 have recently recovered from COVID despite our best efforts to keep them healthy. So they got it. I mean, it happens. Doesn't mean you're a failure as a parent either, by the way. And then thankfully their symptoms were mild. My kids love playing, team sports, and being active. Do I need to be worried about their health post-COVID? What do you tell? So a child gets COVID. Say it's a 12-year-old. He loves to play soccer, is on a soccer team, gets COVID, spends 4 or 5 days with some cold symptoms, but now feels great, wants to go back to playing soccer. Is that okay?
So it depends. Yes, you should be concerned, but concerned for this virus affects the heart, and we're still learning a lot about that. Okay, you can have it affect the heart during the acute COVID illness, or it'll affect the heart afterwards, and we think that's the immune system causing problems with the heart. And anytime you get the virus, if there's a risk of you getting myocarditis or there's inflammation in the heart, then we don't want our kids to necessarily run into a sports event and go hardcore yet until we know that there may not have as much inflammation there. Because when you have inflammation around your heart, there's a risk of having arrhythmias when you're doing those.
Well, what are the symptoms of that?
So you would have maybe some chest pain, palpitations, meaning your heart flutters or beats really quickly, and some have passed out, on the playing field. So we just, we think that the more affected you are with COVID, the first time you got a lot of symptoms, then maybe your risk of inflammation in your heart is a little higher than kids who didn't feel anything at all, and so if you had a severe case of COVID or moderate case of COVID, or if you're even just going in to play sports, right now what we're doing is screening and asking children, how severe was their illness, and then having them have that discussion with their pediatrician. Okay, and the pediatrician is then going to decide, based on how severe their COVID was initially, how safe it is for them to go back into sports and when they can do that safely. So mild cases, generally they go back within like 10 days or so. If they have more severe cases, they're going to consult with a cardiologist and make recommendations after further workup and evaluation. But there's a complex algorithm out there that addresses
So you have something you
COVID.
can that helps guide you.
Online we have guiguidelines that are out there for pediatricians and families.
And the symptoms, so like chest pain, shortness of breath, fluttering, things like that.
Yeah.
That's really good advice. But so, all right. Well, I think I'll go ahead and wrap it up there. So we've been a while. Any pressing questions from the gallery out there?
What impact do you see maskless school districts having on this second surge?
Yeah, that's a good question. Maskless school districts, will it have an impact on our second surge? Yeah, it could. We'll have to see. I mean, the worry would be is that up to date we haven't really had any problems with transmissions in schools. I mean, it occasionally happens, but it's very rare, and we can catch it and cut it off early. If there is transmission in schools that's more widespread, then that can drive viral transmission in a community. Our best example that's probably influenza and the flu, because a lot of the schools always have an impact on that in the community. So yeah, it's possible that a maskless school that ended up getting into trouble with COVID transmission in that school could impact transmission in the community. Obviously, they bring it home. And then what if you have, dad is got lymphoma on therapy, or their mom's got a lot of underlying diseases, and the two adults decided to never get vaccinated, then you could have somebody who's at high risk picking it up from their child. And last spring and winter, we weren't seeing child to adult transmission. It was almost always the other way around. I'm a little bit worried about it this fall in the schools that made masks optional.
For people that are immune compromised, especially young children, should they wait until they get their third dose before going back into school and returning to society as a whole?
So would you say if you had a child who, so this would be an over 12 child who's immunocompromised and has had 2 doses, would you have them wait for their third dose? I don't know, I'd say that'd be something to talk to your pediatrician about, because sometimes there are ways of knowing whether or not you responded, and then there are also, it depends a little bit on what kind of immunocompromising condition you have. They're not all alike. So I'd say talk to your pediatrician or your pediatrician specialist who's managing your condition.
Yeah.
Anything else? Yes.
We had a viewer question come in about boosters and or third shot for the J&J shot.
Oh.
Any insight into people who are in that situation?
Yeah, so yeah, this comes up every week. So the question is, I get by email, like daily, is, I had the J&J shot, do I need a booster? Right now, it looks like J&J's hanging in there just as well as the messenger RNA vaccines in preventing hospitalization and serious disease. And that includes in data in some other countries, but we don't have a lot of other country data because not a lot of other countries use J&J. The other problem is that because of the numbers of people who got J&J are so much smaller than the messenger RNA vaccines, it makes it a little bit harder to know. But so far, it seems to be hanging in there. The problem with it, and we'll see what the ACIP has, because they get a bit of a little dilemma when they decide what to do, is that there's very little information on J&J vaccine being followed up by a messenger RNA vaccine, which is, I think, what a lot of people are asking about. So would it be J&J followed by a J&J vaccine? We'll have to see, because the trials with that have been slow to enroll. And so we don't have a lot of information. So it might be, you might see when the boosters come up, it may be that it only addresses the messenger RNA vaccines, and it says more information is needed about J&J. But we'll have to see how that goes. So right now I'm telling my people who've gotten J&J that be reassured right now it's protecting you from severe disease, hospitalization, and death. And hang in there, we're trying to get the data to find out what the best thing to do for you is with the booster.
And that second viewer question that came in, how are you defining long haulers? What sort of characteristics need to happen to kind of fall into that designation as a long hauler?
Basically, it's persistent symptoms, as Kacy was talking about earlier. In adults and kids, it seems to be kind of the same, kind of a brain fog, fatigue, headaches, and exercise intolerance. Some people have sleep problems, sleep difficulties. You know, I think they're wrestling with the case definition for this still. It hasn't been totally hashed out yet. But it's reminiscent of chronic fatigue syndrome and other post-viral fatigue illnesses that sometimes we see. And I think it'll probably end up being in that ballpark. The problem with long haul symptoms is that these are all called somatic symptoms, so we can't do a CT scan and see it. We can't do an MRI. There's no blood test. There's no way of seeing how it's affecting an organ. And this is how we generally in Western medicine do things. And so it's a little bit hard to know exactly what causes these and why people feel that way. And don't get me wrong, it doesn't mean I don't believe they don't feel that way. I do. It's just, it's a little bit harder for us. And we've wrestled with this in medicine for decades. In fact, since you go back to the Civil War, and there are reports of people having long haul-like symptoms after events. It's almost sometimes like PTSD. It's a little hard to sort out. So there'll be case definitions that'll come up, and then we have to find out the best way to approach it. So for most long haul now, at least in adults, it's basic wellness. Mm-hmm. For adults, avoiding things like alcohol and other medications and that might affect the brain and its functioning. Regular exercise in a limited way, particularly low impact type exercises. Mm-hmm. Sometimes talking to other people with long haul symptoms and sort of those group experiences helps you a little bit with the psychologic aspect. Sometimes there are some medications that can help. With the aspects of depression that sometimes come with it. So it's going to take us a while, and we need better studies over the long term to know how to deal with it, but it's important.
Last question. Mm-hmm. As we are getting ready, and some districts have already started school, can you both speak to just addressing the stress and the worry that I think the students themselves are feeling? I think I've met some kids who are very scared. You know, the parents too, who have the anxiety that might be coming with the start of the school year. Yeah. How do you help people manage the worry they're feeling?
I'll let Kacy take this one first. And
I think we have to focus on what we can control, right? Because we can't control everything. I struggle with this every day. But it's what we can control is the discussions we have with our children about the importance of masking, social distancing, washing our hands, listening to the teachers about cohorting and just doing the best that they can. That's the best that you can do. And what else? Just know that I don't know what else.
Well, you know, I compare it to is like, you know, and I think back to my own time. It's sort of an anxious time before going to school anyway, yeah. Right? Even without COVID.
Yeah.
And sometimes it's just sticking your toe in the water and going through that first day and just getting used to it a little bit.
And trying to get the vaccine as soon as you can.
Yep.
And getting them vaccinated is, that's the biggest piece of Swiss cheese, right? So,
So going to school, first day can be scary anyway. So some of it's that, but I think that the big thing is do the things that you can do, that you have control over, and wearing a mask and watching out how you do the after school activities. And how you interact and get together with your friends. Those are the big ones.
Yeah. Safest thing is doing that together outdoors. I mean,
Yep.
that's the safest thing. So do as much as you can outdoors or in big ventilated spaces, and wear your mask when you're
Yep.
in
And
those
tell the
situations.
kids you'll be fine.
Yeah.
Yep. All right, we'll see everybody next week, which will be the week before Labor Day. Hopefully it'll be peak week for COVID wave.